So hello guys, today I'm going to discuss one important topic which is usually happen in our daily life, more common problem in our daily basis life. Okay, so today I'm going to discuss about hypertension. Are you able to see hypertension? So before I'm going to discuss about hypertension and anti-hypertensive drugs, so we should know what is hypertension, right? So hyper, by that name only we can understand the things which will be increased, right? So anything will be increased in level. So here what will be increased? Like the tension will be increased, right? The tension will be increased. So hypertension, what is hypertension? So increasing blood pressure level. Okay, so that is called, we are usually called hypertension. Okay, hypertension. So before we should discuss about the increasing blood pressure level. We should know the normal value of the blood pressure, right? So the normal value of the blood pressure is 120/80 mm Hg. So here 120 indicates diastolic pressure, and 80 is indicating the systolic pressure. Okay, so when the blood pressure is increasing more than 120 mm Hg, more than 120, not 120, more than 140 mm Hg, okay, so then we used to call hypertension, right? So how the hypertension is happening? One mechanism is on one pathway is there, we should to know. So if we know that pathway, we can easily give any kinds of drugs about to the hypertension. So we should know the pathway, that pathway we are using, that pathway is called renin angiotensin pathway. Okay, remember that thing. What is the pathway? Renin angiotensin pathway. Okay, so there we will discuss three receptor like alpha, beta 1, beta 2 receptors. Okay, don't be so worried, I will discuss each and every point and it will be so easy to remember it. Okay, so first of all we should to know the alpha receptor. So alpha receptor usually present in blood vessels. Where would it is present? Blood vessel. Okay, and beta receptor, it is usually present in brain and kidney. Okay, and beta receptors have two types. What are that? They are beta 1 and beta 2. Okay, let's start with the topic. Let's start with the pathway. So that is the brain. From the brain we can see the blood vessel. Okay, the blood vessel, and the another one is heart and kidney. So one thing I have forgot, that beta receptor also is present in heart. Okay, so what is happening? So from the brain everything is happening. Okay, from the brain is everything is happening. So see, the brain is releasing alpha receptor. Okay, brain is releasing alpha receptor, and it is also releasing the beta 1 receptor and beta 2 receptor. Okay, so after releasing the alpha receptor in blood vessel from the brain, what is it doing? The blood vessel, when it's vasoconstricted, one word is vasoconstricted, I will told you later what is the vasoconstriction. So when the blood vessel is vasoconstricted, what is happening? We can see the increased peripheral vascular resistance. Okay, so thereby we can see the increasement of the blood pressure, BP, blood pressure. Okay, so I told you the vasoconstriction. What is the meaning of the vasoconstriction? See, vasoconstriction is nothing but the narrowing. Okay, what is the narrowing? Suppose this is a tube. Okay, normal blood flow is going like that in the tube. Suppose this is water flow, and in that tube the water is flowing like that simply. So when it becomes narrowed or vasoconstricted, what will happen? See, like that. So what will happen? Suppose the flow is 20. Okay, after the vasoconstriction, so the flow will be, what it will try? It will try to maintain the same flow, right? So it will try to maintain the 20, the flow rate 20. It will try to maintain. When it is become narrowed, what will happen? The flow rate will increase. So that's why we can see increasement of the blood pressure. I think you get understand, right? So when the water is flowing normally, no pressure is there, no pressure is increasing. When it is become narrowed, we can see the pressure is increasing, like that only. In our veins or arteries, the pressure is increasing like that only. Okay, so we can see the increasement of the blood pressure. So next come to the heart. So after releasing of the beta receptor from the brain to the heart, what is happening? It normally, why the blood pressure is increasing? So after releasing of the beta 1 receptor, we can see the increasement of the, so the heart is vasodilated. Okay, vasodilated. So what is happening? We can see the increasement of the heart rate, okay, and we can see also the increasement of the cardiac output. Okay, so what will happen after the increasing of the cardiac rate or heart rate and increasement of the cardiac output? What will happen? If the heart rate will be increased, what will happen? The blood pressure also will increase. So like that only, after the releasing of the beta receptor from the brain to the heart, we can see the increasement of the blood pressure from our heart due to beta receptor releasing. Okay, so next to the kidney, how is being happening by the kidney? How it's happen? The kidney, through the kidney, the pressure, how it is increasing? So see, so after releasing the beta 2 receptor from the brain into kidney, we can see the kidney is releasing one enzyme called renin. Okay, that renin also increasing or releasing one enzyme called angiotensin. Okay, so angiotensin 1, it is releasing angiotensin 1. So renin is releasing angiotensin 1 with the help of angiotensinogen angio angiotensinogen enzyme. Okay, so again we can see the angiotensin 1 is converted to angiotensin angio angiotensin 2. Okay, so that angiotensin 2 again it is releasing angiotensin 2 receptor. Okay, angiotensin 2 receptor. Okay, so after releasing the angiotensin 2 receptor, it is helping to what is helping to increasement of the peripheral vascular resistance PVR. Okay, so thereby you can see increasement of the blood pressure. So one thing I have forgot, that angiotensin 1 is converted to angiotensin 2 by the help of enzyme called ACE. So see, what is the ACE? ACE is nothing but the angiotensin converting enzyme. Okay, so there also, so thereby we can see increasement of the blood pressure. Okay, so one another way also there, in that way also we can see the increasement of the blood pressure. So see there, angiotensin 2, it is triggering the adrenal medulla. So adrenal medulla, suppose that is adrenal gland, that is the adrenal medulla, outer layer, that is the adrenal medulla. So adrenal gland, as we all know, the adrenal gland is present, but anterior, not anterior, like superior portion of the kidney, and it is shape in pyramidal, right? So it is shape in pyramidal shape, and the outer layer of the adrenal gland we are calling adrenal medulla. Okay, so adrenal medulla is releasing aldosterone. Just be concentrate on that. So aldosterone. Okay, so one function of the aldosterone is reabsorption of H2O and Na plus. Okay, reabsorption so after reabsorption of the H2 and Na plus, the abdomen, in our abdomen, right, what will happen? Or blood vessels, what will happen? They will be increase, right? Or the blood volume will be increased. So that same thing is happening, like blood volume increased blood volume. Okay, so increased blood, so it's little bit congested, but try to understand on the topic and concentrate on the topic. So after the increasing of the blood volume, can you see? Yeah, increasement of the blood volume, we can see the increasement, it is directly inducing the BP increasement. Okay, now I think you have all understand, right? So let's revision on the topic. So we as you will know that hypertension means the increasing of the BP. Okay, so when the blood pressure will be increased more than 140 mmHg. Okay, so then we will call as hypertension. Okay, so how it is been happening? So let's see. So there is three types of receptor First one is alpha receptor, second one is beta 1 receptor, third one is beta 2 receptor. Okay, so alpha receptor is acting mainly blood vessel. Okay, and the beta 1 receptor is acting heart and kidney. Okay, so after releasing of the beta 1 receptor, we can see in our heart increasement of the heart rate and increasement of the cardiac output. So thereby you can see the increasement of the BP, right? So next thing is the beta 2 receptor, which is promoting the kidney to releasement of the renin. Okay, renin is a protein. Okay, so that renin is also helping to releasing or converting to angiotensin 1 with the help of angiotensinogen enzyme. Okay, so by that angiotensin 1 is converted to angiotensin 2 with the help of angiotensin converting enzyme, angiotensin converting enzyme. Okay, so angiotensin converting enzyme, so that angiotensin 2 is releasing again angiotensin 2 receptor. Okay, so that angiotensin 2 receptor is releasing or helping to increasement of the peripheral vascular resistance. Okay, so after the increasement of the peripheral vascular resistance, we can see increasement of the blood pressure, right? So let's come to the blood vessel. After releasement of the alpha receptor from the brain, we can see the blood vessel is vasoconstricted. See, vasoconstricted. As I discussed previously, that vasoconstriction means the narrowing. You can see narrowing. So the flow will be the same, blood flow will be there, but the pressure will be increased. That's what the vasoconstriction. So after the vasoconstriction of the blood vessel, we can see the increasement of the peripheral vascular resistance, so thereby inducing the blood pressure. Okay, so I think you all have understand. So we have to the remedies. Okay, for how to treat the hypertension. Okay, so how to treat the, so we should use, so the classifications of anti hypertensive drugs. Okay, classification of the anti-hypertensive drugs. Okay, so what are they? So they are beta blockers. So you can also guess, so how can we will block the renin angiotensin pathway? So we can using the beta blockers, right? We can using the beta blockers, or we can using the anticholinergic drugs, central sympatholytic drugs, right? So thereby you can see the blockage of the alpha receptor, right? So after the blockage of the alpha receptor, we cannot see the vasoconstriction of the blood vessel, right? So after we cannot see the vasoconstriction of the blood vessel, we cannot see the increasement of the blood pressure, so thereby we can reduce the blood pressure, right? So that is the sympatholytic drugs. Okay, and the second one is the beta blockers. So if you all block the beta blockers, we cannot see the cycles, right? The continuation we cannot see, right? See, if we'll block their beta blockers, so we cannot see the cycles or the continuation of this process. Okay, so thereby we can reducing the blood pressure. Or calcium channel blockers or CCB. So next video I will upload the calcium channel blockers, don't be worried. Okay, and the next drugs are direct renin inhibitors. So if you direct inhibit the renin, so we cannot see the renin is converting to renin angiotensin 1, right? Angiotensin 1, and we cannot also see the conversion of the angiotensin to angiotensin 1 to angiotensin 2, and we cannot see the angiotensin 2, the conversion of the angiotensin 2 receptor, that we can resist the increasement of the blood pressure, right? So thereby the next drug is the direct renin inhibitor. Okay, and we can see also ACE inhibitors. As I told you, the ACE is angiotensin converting enzyme, right? So ACE inhibitors means if you the block the ACE inhibitors, so we can see easily resist the increasement of the blood pressure. Okay, and the main thing is the for the resist the blood pressure, that main thing is the diuretics. So there we can see diuretics like aldosterone is playing a major role the reabsorption of the H2O and Na plus, right? So the H2O mean water and sodium electrolyte, it reabsorbing, right? And the blood volume is increasing, so the blood pressure is increasing, right? So if we use the diuretics, we cannot see the reabsorption. So if the reabsorption not takes place, mean the water is not accumulating in our abdomen or blood vessels, and the sodium ion is not accumulating in our blood vessels or abdomen, we can see not increasement of the blood volume, right? So thereby we can decrease or resist the blood pressure increasement. Okay, so these all the antihypertensive drugs. So here I am writing. So first one is the beta blockers, second one is the sympatholytic drugs, and the third one is the calcium channel blockers. Fourth one is the ACE inhibitors. So these all these things are very easy, just you have to concentrate on that and try to be understand, don't be by hearted. If you'll do by heart it, you'll be forget it very soon. Okay, so the ACE inhibitors and the diuretics, and the another thing was, what is that, direct renin inhibitor. Okay, inhibitor, right? So I'll simply tell some of examples of the drugs. Okay, so calcium channel blockers, the examples of the calcium channel blockers is like amlodipine, nifedipine. Okay, the ACE angiotensin converting enzyme, prils, all prils. Examples: captopril, ramipril. Okay, perindopril. Okay, so the diuretics, different types of diuretics there. Thiazides, and thiazides, loop diuretics. Okay, and the sympatholytic agents are there. Some of sympatholytic, like centrally acting sympatholytics, those are included clonidine, alpha methyl dopa. Okay, alpha methyl DOPA. And the beta blockers, the main thing is like beta blockers. What are they? So beta blockers are like all lols. Okay, easy remembering. See, lols, atinolol, okay, metoprolol, okay, timolol, etc. Okay, so next thing is like direct renin inhibitor. So I think I have forget. Okay. Direct renin inhibitors. Okay, so these are the all of anti-hypertensive drugs. Okay, I think if you having, okay, I think this topic is completed. Okay, if you have any kinds of doubts, so just do comments on the comment box. Okay, and do subscribe and press the bell, notification bell, for getting more uploaded videos, and do likes. Thank you. Stay happy, stay safe. Thank you.